fly around and be exhausted, especially if we're going to talk for a day. So anybody that wants to come in will be part of the documentary film we're putting together and other communications. So we'll make you famous because that's how I introduce these speakers as the finest in the world. And fortunately, I don't have to lie about it. I have to tell the truth. We do have the best speakers. Anyway, the year of child environmental sustainability and decreased toxicity. All of us, every one of us has talked at the end of all of our therapies, but we have to stop the poisoning. This is the place, the organization, the film production program. My friends fly out in helicopters and film out. I was with the Mount Rushmore more film head today. And then he was working again with the Indians who are there running Mount Rushmore now. So we have the connection with the Indians too, the Native Americans. Like I said, today they were honoring the dead at the burial ground. That's an eagle's flying over my head, and there's the Indian burial ground. And we cut these deals today out of nowhere within like 10 minutes. I'll shut up. Our board select committee of research, and that's headed by Dr. Quinn, by the way, will decide which topics are the top three most important to us all. The nouveau sujet, the new topics, okay? Will help. Well, okay. The new topics will help to lead us in the most efficient way. We're trying to go where the best medicine is. And without the research, how do we know where to go? So the research is a big thing. It's headed by Dr. Quinn. We will lean on the past, knowledge, right? We will lean on the past, but realize the future, the word realize. By doing the research, the action, and the other things like this, we are realizing, we are making it happen. That's what that means. We realize the future. New topics will help to see that future. And those are like the people we have on the screen right now. This is an announcement conference. We announce the future. You like that slogan? We announce the future. And I'm telling the truth, so I don't have to be too screwy about it. So Friday, ready for this? Friday. And if we have 8 hours, 4 in the morning, 4 in the afternoon, and everybody gets 1 hour to get on that stage and speak from the same podium as RFK spoke, to speak at the same podium as Jimmy Carter spoke. You get on the stage, you get behind the podium, we film it. You become part of our documentary film. And we got that agreed to, by the way. So I can have a number of cameramen and other people running around being obnoxious. And they said that's fine. They allowed us to do it. And another reason, if you're doing
Why don't we
a lot of, sorry,
why don't we get started with the lecture and then we can finish this afterwards, okay?
I agree totally.
Okay.
Go for it.
Okay. All right. So our speaker today was supposed to be Dr. Jacqueline Salmons, and she couldn't make it. So you got me. So those of you who don't know me, I am Bill Clearfield. I've been the titular head of the this group since 2020. We've been running these seminars every Tuesday night for 4.5 years. We are the integrative medicine group, not associated with the AOA anymore. So tonight I'm going to talk about the microbiome, and this is a lecture that I'm going to be giving in April of next month in Miami to the Age Management Medical Group. And unfortunately, I understand it's the same weekend as A4M. So I don't know what kind of crowd we're going to have. But so this is kind of a trial rehearsal. And if you like it, fine. And if you don't like it, send me some hate mail. So we're going to talk about the microbiome. And again, it's a CME credit, so I have no conflicts here. We're going to talk about what is the microbiome. Hang on, though. Let us, before we do that, let us record. Are we recording?
I believe so.
Okay, I don't see it here.
I see the recording up in the upper left-hand corner.
Okay. All right. Yeah. Okay, we are. Okay.
Yeah,
What is the microbiome? And we're going to talk about, I lost my pointer. um, let us begin. So the microbiome is a community of microorganisms that exists in a specific environment. And there are actually many microbiomes. We usually think of it as the GI tract, but the oral cavity is a microbiome. The respiratory tract is a microbiome, and the vaginal cavity is also a microbiome. The microorganism groups are dynamic; they change, and we well know this, particularly with diet and exercise and medication and different types of exposures. And now I am really in a pickle here because somehow I got a pencil and I can't advance my stuff. All right, that should do it. Okay. So the microbiomes amount to over 100 trillion cells, 10 times the number of human cells. In the gut, it's composed of bacteria, viruses, fungi, and parasites. And gut microbial species contain 3.3 million different genes versus 23,000 human genes. And it plays a role, and we're going to see this tonight, in metabolic and immune function, cerebral activity, digestive and extra digestive pathologies. So the role of the microbiome is basically balance. You want to be balanced between digestion and homeostasis. It breaks down complex carbohydrates. It produces short-chain fatty acids, glutamine, arginine, vitamin K, and folate. It modulates the immune function. It promotes antigens. It deconjugates bile acids, and it's antimicrobial. It's anti-inflammatory. It regulates metabolisms, and there are links to both the brain and the skin. The story of the microbiome began in 1882. There was a cholera epidemic, and then there was a second one in 1892 in northern Germany, particularly. And there were 8,600 deaths in Hamburg, which was a good portion of the population at the time. And it was due to poor sanitary conditions, bacteria in the gut. And this Eli Mechnikov, he was a Russian biologist, and he proposed that bacteria in the gut prevented cholera from taking hold. So, like his counterpart in the 1980s, Barry Marshall, who had postulated that H. pylori was the culprit for stomach ulcers, Mechnikov proposed that the bacteria in the GI tract left the patients either susceptible to cholera or they were immune to cholera. So he drank some cholera, believe it or not, and he took some plain yogurt, and the yogurt actually was protected against the cholera bacteria. So, okay, the microbiome. It has effects in the brain, what we call a gut feeling, and we're going to come to that. And there are neural, humoral, and immune pathways from the gut to the brain and from the brain to the gut. It's linked to mood and mental health issues, anxiety and depression. Gut bacteria influence neurotransmitters, cognitive function, and neurodevelopmental and cognitive performance. In the skin, there's a community of microorganisms on the skin. The host immune mediation reflects in the skin. The gut microbiomes impact inflammation. And the classic picture of this is psoriasis, caused by the standard American diet. It plays a role in pathogenesis and infections, and imbalances in the skin microbiome results in eczema, acne, psoriasis, and rosacea. The skin is a protective barrier, as you know, and it helps with the moisture and its integrity. Dysbiosis is an imbalance in the microbiome, particularly the bacteria, and it's usually due to obesity, allergies, autoimmune diseases, irritable and inflammatory bowel diseases, and metabolic syndrome. The healing portion, and I use 4 R's. I've seen 5 R's. I've even seen 6 R's. And the idea is that you want to remove the harmful triggers, usually foods, white flour, white sugar, dairy, gluten, and I'm going to add another one here, corn. Those are the most common triggers. You want to repair the gut lining damage with whole foods. Deglycerinated licorice is particularly for upper GI symptoms, particularly gastroesophageal reflux disease, and then L-glutamine for lower GI mucosal repair. We want to restore the bacterial flora that's normal with pre and pro. And if you've been with us over the last 6 months, we've talked about postbiotics and fermented foods. And when we want to replace the digestive enzymes that are present with that are missing with digestive enzymes and organic pink Himalayan salt or even sea salt. And so we're going to talk about the composition, diversity, and function of the microbiome. And I'm not going to read through this, but these are the different normal bacteria in different parts of the GI tract. So all the way from the oral cavity all the way to the end, you can see that it changes. There's Candida and Cladosporum here. These are fungi here in the throat. These are normal. They're supposed to be there in small amounts. And here's the small intestine, and there's Saccharomyces, which we use as a probiotic, and Candida. And then down here, again, Saccharomyces, Candida, and different Bacteroides and Firmicutes. And then we're going to look at the ratio between them as important for GI balance. The composition of the microbiome, as I already stated, is there's bacteria. Firmicutes are gram-positives, and they produce the short-chain fatty acids. Bacteroides are necessary for carbohydrate metabolism. Fungi are Candida and Saccharomyces. It aids in digestion and immune function. Viruses are bacteriophages that regulate bacterial populations and impact microbial ecosystems. And then there are methogens that digest and regulate hydrogen. Influencing factors are diet. Fiber increases diversity. High-fat diets decrease it. Genetics play a role. Age plays a role. The microbiome evolves as one matures. Different medications, particularly antibiotics, we all know this. Probiotics help restore the normal bacteria. And then there are lifestyle issues. Sleep, stress, exercise also all modulate composition. Diet, so high fiber diets promote beneficial bacteria and short chain fatty acids. High fat, low carb diets shift the Firmicutes to Bacteroides ratio in the negative direction. Prebiotics are non-digestible fibers feeding gut bacteria. This is sort of the food for the probiotics, which are live beneficial bacteria, particularly Lactobacillus and Bifidobacter. And then, as we've had with Ross Pelton on with this concept of postbiotics, which are anti-inflammatory, antioxidants. These are the sort of the end products of probiotics. These are the functional portion of probiotics that yield health benefits. Characteristics of the healthy microbiome. We need a high microbial diversity, a rich variety of microbial species. There are measures for it. We don't usually use them, but there are measures. There's an alpha diversity index. Alpha diversity, there's a Shannon index and a Simpson index. I didn't really find a whole lot of information on that. Usually, if we're looking at a GI test, the important ones will be there. The a healthy microbiome tolerates environmental changes. Its functional versatility to metabolize diverse dietary components and ensures metabolic stability. The important phyla are the Firmicutes, the Bacteroides, Bifidobacterium, and the Akkermansia. Functional redundancy is built into the system, and with multiple microbial species that perform similar functions, and that sort of ensures metabolic stability and consistency if some microbes are lost for whatever reason, antibiotic use, diet changes, dietary, things like that. So short-chain fatty acids are made from different fiber substrates by multiple species. Speaking of the short-chain fatty acids, there's three major ones. There's butyrate, which enhances gut barrier integrity. Propionate influences lipid metabolism, and acetate is involved with energy production, and it's a precursor for cholesterol synthesis. Gut barrier integrity is one of the key functions of the healthy microbiome. Butyrate strengthens tight junctions and prevents the so-called leaky gut. Akkermansia forms a protective layer with mucin production. It is anti-inflammatory. It inhibits NF-kappa beta, which results in a reduced interleukins 1b, 6, 12, 18, and TNF-alpha, and it promotes Treg production. In metabolic health, fiber fermentation converts polysaccharide.
You kind of cut off there for a little bit, maybe for like 30 seconds.
Yeah, I think my internet connection is going to go out again like it did before. So, can you hear me now?
Yep.
Okay. You want me to go back?
It's up to you. I don't know.
Where did I leave off?
Well, I don't think we heard the current slide at all, did we?
Yep, the current slide we didn't hear.
Okay.
Yeah, that's where we are.
Okay. Short chain fatty acid production is butyrate, which strengthens tight junctions and helps prevent the so-called leaky gut. Akkermansia produces the mucin layer or protective layer, sort of above the main barrier. Anti-inflammatory functions. It inhibits NF-kappa beta, reduces interleukin 1b, 6, 12, 18, TNF-alpha, and it produces Treg cell production. Metabolically, fiber fermentation converts polysaccharides to short-chain fatty acids, and it produces vitamins B2, 6, 12, and K2. Lipid and glucose metabolism. The microbiome modulates gluconeogenesis, fatty acid oxidation, influences insulin sensitivity, and lipid homeostasis. It reduces chronic disease states, particularly obesity. It actually regulates GLP-1, decreases inflammation, and supports energy balance. Cardiovascular health is implied with a healthy microbiome that creates vasodilatation, reduces blood pressure, and TMAO. In the spinal column and nervous system, vagus nerve signaling is smooth with a healthy microbiome. It improves mood and cognition, and it stimulates tryptophan metabolism and serotonin production. In the GI tract, short-chain fatty acids break down fiber to absorbable form. They regulate cholesterol and fat absorption, and they convert primary to secondary bile acids. What happens when you have a dysbiosis? So as you can see here, this is over here on the left, this is a normal microbiome, and this is an abnormal microbiome. And you can see we have all sorts of bad guys in here. So a healthy microbiome has a lot of diversity, as the dysbiotic one does not. Metabolic byproducts are short-chain fatty acids, vitamins, and beneficial metabolites. And in the dysbiotic microbiome, we develop inflammatory cytokines, lipopolysaccharides, and ammonia. Pathogen prevalence is low with a healthy microbiome with a high colonization resistance. And in the dysbiotic, we have an overgrowth of pathogens and opportunistic microorganisms. Decreased microbial diversity results in a reduction in key beneficial species, particularly Bifidobacterium and Faecalibacterium, and an increase in susceptibility to environmental stressors and pathogens. An overgrowth of pathogens can occur, like C. difficile, E. coli, and Salmonella, and the imbalances favor pathobionts producing toxic metabolites. An altered metabolic activity results in a decreased short-chain fatty acid production and an increase in harmful chemicals, compounds, particularly hydrogen sulfide and lipopolysaccharides. Chronic inflammation results in an increased gut permeability, the so-called leaky gut, systemic endotoxins due to microbial derived lipopolysaccharides, irritable bowel syndrome, ulcerative colitis, and even colorectal cancer. Metabolic disorders are linked to insulin resistance, obesity, and lipid dysregulation, and reduced gut-derived GLP-1 also impacts glucose metabolism. Increased susceptibility to infections results from a loss of colonization resistance and allows pathogens to overgrow. The neurological impact of a dysbiotic microbiome results in anxieties, depressions, autism, psychiatric and neurodegenerative diseases. And systemic effects include risks from TMAO production by dysbiotic microbes, and as we've seen before, psoriasis and eczema. The etiology of the dysbiosis is we call intestinal permeability. And this is a fairly sophisticated slide. We have patients with environmental factors, stresses, infections, nutritional deficiencies, genetic stabilities, creates an increased risk, which creates antigens present in the GI tract, improper oral tolerance, enhanced allergic sensitivity. So this would be food sensitivities, intestinal permeabilities here. We have cytokine abnormalities leading to systemic allergic reactions. We also get mast cell activation with histamine overload and inflammatory mediators, and it becomes a vicious cycle. Intestinal permeability refers to the barrier function of the intestinal mucosa. Sorry about that. I'm getting messages here. Okay. The intestinal mucosa provides a protective barrier against the external environment and function in active and passive transport. An intact intestinal barrier is essential for normal physiological function and prevention of disease. Intestinal permeability is when the epithelial barrier becomes permeable, allowing the passage of substances that would normally be blocked. Other related terms include leaky gut, autointoxication, and endotoxemia. Why is this important? Well, the intestinal barrier has a dual function. It provides a protective barrier against external stimuli and functions in an active and passive transport. Disease pathogenesis, we get increased epithelial permeability. It's a crucial primary or secondary event in the pathogenesis of atopic, inflammatory, and atherosclerotic disease entities. Associated disorders include irritable bowel disease, infectious and metabolic disorders, and associated with a dysfunctional intestinal barrier. There's an autoimmune connection. Increased intestinal permeability leads to the translocation of macromolecules and the initiation of the autoimmune spectrum. And restoring a healthy function of the intestinal barrier can halt this autoimmune process. Factors that impair the intestinal barrier include stress, infections, again, the dysbiosis, which is an imbalance in gut microbiome, inflammatory situations, and poor diet will also impact gut integrity. What are the triggers? And the triggers of dysbiosis include food allergies and sensitivities and intolerances, stress, infection, inflammation, systemic diseases, impaired digestions, toxins, nutritional insufficiencies, and medications. It results in food allergies and insensitivities, malnutrition, and increased uptake of toxins and lipopolysaccharides. Put it all together, we get an elevated toxic burden and antigenic burden. We get an immune activation and systemic disease. Nutritional support for the intestinal barrier includes anti-inflammatory foods. This is the multicolored vegetables, fruits, and omega-3 rich foods that help restore the intestinal barrier. Probiotic rich foods, which are fermented foods like yogurt, kefir, sauerkraut, that support beneficial gut bacteria. Prebiotic fibers, these are your soluble fibers that feed the beneficial bacteria. And we like L-glutamine a lot. This is an amino acid that serves as fuel for intestinal cells and supports repair. Lifestyle changes for gut barrier health, stress management, proper hydration, regular exercise, and mindful eating, which is slow, thorough chewing and relaxed meals that improve digestion and reduce stress on the intestinal barrier. So Dr. Burgess, put the cell phone away, put the TV away, and pay attention to what you're doing. Disease processes due to dysbiotic microbiome include gastrointestinal disorders, again, irritable bowel syndrome, Crohn's disease, colon cancers, ulcerative colitis, reduced production of short-chain fatty acids result in gut inflammation, overgrowth of harmful bacteria exacerbates symptoms and will result in Clostridium difficile and E. coli infections. Gut microbes can influence energy harvest from food and regulate fat storage, and this will show up as insulin resistance, lipid imbalances, and chronic low-grade inflammations. Autoimmune conditions with the leaky gut allow antigens to enter circulation. They trigger autoimmune reactions, particularly Th17, and specific imbalances are linked to Sjogren's disease, multiple sclerosis, lupus, and rheumatoid arthritis. Neurological disorders can result from a disconnection of the gut-brain axis with neuroinflammation and neurodegeneration, and it can work adversely and affect neurotransmitters, particularly serotonin, and can worsen Parkinson's disease and Alzheimer's disease. Chronic inflammation and cancer results from endotoxemias that fuel inflammation and bacteria that exacerbate colorectal cancer. Antibiotics are a special category. Long-term use of antibiotics, or even short-term use, sometimes some patients are just immediately susceptible to them. We get a loss of microbial variety in the gut. Antibiotic resistance can develop. We get a weakened gut barrier, and we can get cognitive decline and chronic diarrhea through this process. The penicillins induce immune deficiency diseases. The macrolides can alter mucus secretion and alter ion transport and inflammation. And metronidazole decreases diversity and can alter lactobacillus iners, which is a marker for gut dysbiosis. Oral contraceptives can result in inflammatory bowel disease, and the synthetic estrogens alter intestinal permeability. It alters the balance of Th1 to Th2 cytokines. Androgens can alter gut flora balance also, and gut estrogen disruptions are a two-way street, so they can go either way, and we end up with inflammatory bowel disease. Nutrients that can get disrupted with a dysbiotic microbiome include vitamin K2. Vitamin K2 prevents gut cognitive dysfunction. Vitamin B12, which can result in peripheral neuropathy. We get an alteration in homocysteine and also mean corpuscular volume, which you'll see in the CBC. And you get gut architectural changes. And magnesium can restore GI flora. It can become malabsorbed with proton pump inhibitors, resulting in irritable bowel syndrome, ulcerative colitis, and other deficiencies. Vitamin D is an immune modulator. It increases Akkermansia and Bifidobacterium. We will get, with low vitamin D, a reduced microbial diversity and increased prevalence of gut pathogens. Vitamin D is anti-inflammatory. Inadequate zinc results in an impaired immune response. And zinc will help maintain the gut barrier. High and low levels can disrupt this barrier and result in GI infections. Iron is necessary for oxygen transport. A low iron will result in an overgrowth of E. coli and a suppression of lactobacillus. Vitamin A helps maintain gut epithelial lining. It's crucial for skin growth development, and it can be disrupted with a poor diversity. And copper is an enzymatic process and can also, with a reduction in copper, reduce diversity. Microbial imbalance can result in pro-inflammatory cytokine, can fueling low-grade inflammation. Just aging, again, as we mentioned before, can lead to altered gut microbial diversity and abundance. It can increase Akkermansia and reduce Bifidobacterium and Lactobacillus and the other ones that you see there. Key mechanisms for leaky gut syndrome are an increased intestinal permeability, which allows bacterial endotoxins and lipopolysaccharides into circulation, results in reduced short-chain fatty acids, which are anti-inflammatory. Health outcomes: increased risk of frailty, cognitive decline, cardiovascular disease, and type 2 diabetes. Impaired gut-brain communication exacerbates age-related health problems. And now the so-called gut-brain axis. This is the butterflies in the stomach, gut feeling, gut retching, gutting it out. These are all terms we've used, throughout our lives. The gut-brain interaction is bidirectional. The functions that are affected are hunger and satiety, food preferences and cravings, food sensitivities and intolerances, gut mobility, digestion, and metabolism. The enteric nervous system is controlled via the vagus nerve, and that's the sensory information that goes from the gut to the brain. And then there are motor signals that go from the brain to the gut. The gut microbiome generates neurotransmitters, including dopamine, norepinephrine, serotonin, and GABA. And this can influence things like mood, behavior, stress levels, pain sensitivity, cognitive function, and immunity. This is just a schematic of that. And the three takeaways here are: there are metabolites from the gut-brain axis, there are hormones that are regulated here, and there's also neurotransmitters, which we've just mentioned. Hormones, as you know, I'm the hormone guy, so I always like to look at what effect the hormones have on whatever our topic is. And so the gut microbiome and the brain, cortisol, stress hormone, can alter Bifidobacterium and Lactobacillus, leading to dysbiosis and low-grade inflammation. The glucose metabolism is inhibited with food intake and stimulates brown fat thermogenesis and activates lipolysis. Ghrelin and orexin reestablish appetite during fasting and affect the growth hormone development through the growth hormone pathway. Gastrin and CCK and pancreatic polypeptides are satiety and gastric emptying substances, and peptide double Y slows gastric motility and reestablishes satiety. Key neurotransmitters that are generated in the gut, we've already mentioned them. There's dopamine, which is your pleasure and reward center. Norepinephrine affects alertness and arousal. Serotonin affects mood, appetite, and sleep. And GABA is your inhibitory neurotransmitter and reduces neuronal excitability. Gut microbes produce neurotransmitters, metabolite transport, enter the bloodstream and reach the brain, and they impact your mental health. Anxiety and depression, the gut factor, is tryptophan metabolism, serotonin synthesis, and mood modulation. General mechanism of action: with gut dysbiosis with hormones. You get a reduced microbacterial diversity, inflammation, and nutrient absorption, altered short-chain fatty acids. Estrogen particularly extinguishes fear. Beta-glucuronidase increases circulating estrogen. Elevated beta-glucuronidase, our antidote here, is calcium D-glucarate, 250 milligrams twice a day. We see a patient, a particularly postmenopausal patient, with elevated estrogen levels and a GI dysmotility. The calcium D-glucarate is your go-to. For testosterone, dysbiosis degrades testosterone, leading to low testosterone, which, as you know, if it goes low enough, there's a frank depression that can develop. The levels are at the patients, if male patients, total testosterone is at risk at 295, and females at 22, and a frank depression for males at less than 150 total testosterone, and for females less than 11. Progesterone dysbiosis disrupts metabolism and breakdown of progesterone, leading to low progesterone. We see greatly elevated levels in pregnancy that can result in listeria infections, which can lead to premature labor and stillbirth. Abnormal progesterone levels inhibit Th1 responses and the production of pro-inflammatory cytokine interferon gamma, and it produces a Th2 response with a synthesis of anti-inflammatory cytokines, interleukins 4, 5, and 10. The thyroid, is famous as an autoimmune sensitive organ. Disruptions in the microbiome can disrupt absorption of iodine, which interferes with T4 to T3 conversion. Leaky gut is particularly sensitive to celiac and non-celiac wheat sensitivities. We get an increase in firmicutes to bacteroidetes ratio with a decreased bacterial diversity, decreased short-chain fatty acids, lipid polysaccharide activation, and decreased mineral absorptions, particularly copper, iodine, iron, selenium, zinc, and vitamin D. Dysbiosis creates an increase in cortisol output. We get circadian rhythm disruptions. We get increased stress-related symptoms and increased gut permeability. Remedies here for high cholesterol or high cortisol, dietary fiber decreases cortisol. DHEA will balance cortisol. So patients with high DHEA levels, usually have high cortisol levels have low DHEA levels, and you can measure a ratio of the two that we want to balance to. And inulin, which is a prebiotic, decreases cortisol also and improves cognition. Decreased cortisol results in circadian rhythm disruptions with decreased diversity and an immune impairment. Growth hormone, remember the active portion of a growth hormone is IGF-1, which becomes disrupted with production and signaling. This is due to an interleukin 6 excess, which creates a relative IGF-1 deficiency. This can result in impairment in development with deficits in what we call executive function. This was the kind of the aha moment for traumatic brain injuries and hormones pairings. It's prevalent in autism and also traumatic brain injuries. Excess growth hormone versus deficiency, we get some opposition species, including proteobacteria, campylobacter, and actinobacteria. We get an excess of versus deficiency of opposite microbial maturity, and excess versus deficiency in metabolite counts. I'm going to take a brief segue. Some of you have heard my lectures on autism, and this is a good spot to just give you just a quick run through here, because the microbiome is extremely sensitive to, and disrupted with autistic children. This is just a schematic sort of the symptoms here on the outer portion. These are the hypersensitivity, language delay, repetitive behavior, social isolation. The etiologies are not clear. but there's what's called maternal activation, which could be a placental separation, it could be placental infection, it could be a drug-induced symptoms. Results in microglial activation, which the microglia is the inflammatory cells, neurons in the brain, which creates inflammation and the cytokine storm. It results in what we call the big-headed kid. So, all babies have big heads versus their body, and it's usually not noticed till afterwards or retrospectively that the autistic children have extremely large heads versus the rest of their body. And it turns out that they have an elevated growth hormone and elevated interleukin-6, but a diminished IGF-1. Remember, IGF-1 is the portion of growth hormone that must be there for growth hormone to be able to perform its functions. It also has this is IGF-BP1. This is a transport protein which is elevated, which also binds IGF-1, which creates cellular damage. Low GABA, which we already mentioned, is your calming neurotransmitter. Here are the symptoms of growth hormone deficiency on the left, and the symptoms of the autistic spectrum on the right. And as you can see, they match almost line per line. The inability to switch between tasks, the inability to get things done, what is known as executive function, was the key here that gave us a clue that this is what was going on. And we have to remember that this is the steroidogenic pathway, and what we're looking for, this is the one that we normally look at, is that cholesterol to pregnenolone to DHEA to testosterone to dihydrotestosterone. But there's another pathway that's in the brain that's not very well studied or not very well known about, and that's pregnenolone to progesterone to dihydroprogesterone to allopregnenolone. Allopregnenolone is the linchpin that produces GABA, the calming neurotransmitter. If you give a patient benzodiazepines, Valium, Xanax, any of the Razapam, any of them, mechanism of action is they stimulate allopregnenolone to make GABA. So if we're able to do that without using the benzodiazepines, although they're inexpensive, that they're addicting, they create respiratory issues, and there's a lot of drug interactions. And this is where a lot of the behavioral issues with the autistic children, this is where the action is. This is just a summation of what I just told you about autistic kids. You get maternal immune activation factors. It can be infectious. It can be placental separation. You get microglial activation, inflammation, cytokine storms. The hypothalamus and cerebellum become enlarged. The cerebrum become enlarged, sorry. Cerebellum shrinks. We get an increase in serum growth hormone, an increase in interleukin-6. We get interleukin-6 blocks the conversion of growth hormone to IGF-1, and we get an increase also in IGF-1 BP1, which is the binding protein. The cerebellum particularly is high in IGF BP1. The cerebellum is what produces the GABA, the calming neurotransmitter via the Purkinje fibers. This shrinks in response to increasing growth hormone, which continue to damage these Purkinje fibers. A decrease in GABA results in repetitive behaviors, language delay, social withdrawal, hypersensitivity, or what we call autistic behavior. So that was just a little segue into autism. You can see how these entities sort of interact, and it all begins, as Hippocrates said, in the gut. Insulin, if there's insufficient insulin or too much insulin, we get inflammation, leaky gut. Again, the decreased short-chain fatty acids, increased lipopolysaccharides, and we get what is known as insulin resistance. Imbalances in the immune system, nervous system, and hormones can signal skin and GI issues. The communication, again, is bidirectional. The dysbiosis is reflected on the skin as acne, eczema, and rosacea, specific bacteria for specific maladies. These can be replaced. So ruminococcus leads to gut barrier dysfunction and irritable bowel syndrome, coronary disease, eczema, and spondyloarthritis. A decrease in akkermansia affects psoriasis progression and is inversely associated with cardiometabolic diseases, diabetes, obesity, and low-grade inflammation. Stress will increase cortisol, which disrupts the balance of hormones. It can impact the integrity of the gut lining and skin barrier. It modulates neurotransmitters, dopamine, norepinephrine, serotonin. Again, and hormones. Estrogen strengthens skin barriers. You can see this, and if you go to a nursing home, you can see the elderly females in the lunchroom. The ones that have nice, smooth skin are the ones who maintain their estrogen, and the ones who, and also their bone structure. And the ones who don't, they're all slumped over, and they're barely breathing with all wrinkled skin, had no estrogen. Progesterone will balance keratinocyte production. And unbalanced progesterone will result in inflammatory, excessive oil production, clogged pores, and acne-like lesions. Testosterone weakens skin's ability to retain moisture, creates an increase in permeability, increased transepithelial water loss, and compromised skin barrier function. Diet influences the diversity and composition of the gut microbiome. Fiber, fruits, and vegetables and whole grains promote beneficial bacteria and diversity. Fermented foods, high fiber increases anti-inflammatory short-chain fatty acids, and processed foods, added sugars, and saturated fats result in this dysbiosis. Probiotics benefit skin conditions by modulating the endocrine system. They improve acne, eczema, and psoriasis. And topical probiotics can improve skin microbiome and skin barrier. Pre, pro, and postbiotics we've discussed. Dietary fibers feed the gut bacteria. They're derived from grains, beans, and leafy vegetables. The probiotics are your beneficial gut bacteria. They ferment prebiotics to produce metabolites, which are now called postbiotics. They improve the skin issues that we've talked about, and Lactobacillus rhamnosus reduces IGF-1. It increases expression of forkhead box protein, which improves acne symptoms. Postbiotics are inactive microbial cells that produce probiotics. They confer health benefits on the host, and they can include metabolites, enzymes, and peptides. Dietary fibers. So the remedies here: prebiotics, the dietary fibers, the probiotics, and the postbiotics. We discussed the nutritional issues. Vitamin D, our goal is about 50 to 80 nanograms per milliliter. For every 1,000 units of vitamin D, we should get an increase of about 8 nanograms per milliliter in about 2 to 3 months. So if a patient shows up with a vitamin D of 25, if we give them 5,000 IUs a day, remember, it's 1,000 IUs per 8. We'll get 8 points on our nanograms. So 5 times 8 is 40 plus 25. That'll get us right dead center at 65. Curcumin is an antioxidant and an anti-inflammatory. It's beneficial for psoriasis. You want to use about 500 to 1,000 milligrams twice a day. Omega-3 fatty acids are anti-inflammatory and are beneficial for the skin. 2.6 grams EPA DHEA improves psoriasis symptoms. Vitamin A regulates keratinization and sebum production, and you want it should be 8,000 to 10,000 micrograms per day. Vitamin C, 1,000 to 5,000 milligrams per day, will modulate cytokine and will regulate dopamine. Vitamin E is an anti-aging agent. We want to use the mixed tocopherols at 400 units per day. Zinc will improve the immune function and skin healing. We want 8 milligrams a day for females, 11 milligrams a day for males. We need higher doses to help produce hormones. That's another story. Fiber promotes beneficial bacteria and the production of short-chain fatty acids and produces skin barrier integrity. Some herbal remedies: neem, boswellia, Evening primrose oil. Neem is a leaf that comes from India. It's useful for acne, eczema, and psoriasis. Boswellia or Indian frankincense is actually one of the precursor products for aspirin. It's an anti-inflammatory and is beneficial again in eczema and psoriasis. Evening primrose oil is good for atopic dermatitis. Collagen supplementation provides skin with tensile strength. Oral supplementation with fish collagen improves aging skin. 10 grams of fish collagen per day. And NMN is an NAD precursor. It supports mitochondrial function and muscle remodeling. 250 to 600 milligrams per day. Microbiome testing. Individuals seeking who should have it done. If you're looking for optimized health, those with chronic digestive diseases, autoimmune diseases, known gastrointestinal disorders, neurologic and cognitive function that is not amenable to by the time they get to us, they've been to most of the specialists. Skin conditions, metabolic and weight issues, and those who whatever question you ask them, they'll say that they'll give you an affirmative answer, what I call mishuginosis. There are lots of GI tests. I like this one. Since we're in the CM portion, I won't tell you which company makes this, but I like this one. It's simple, and it gives us all the information we need. There are more sophisticated ones with lots of colors that are a lot more expensive. This is a quantitative polymerase chain reaction test that gives us the DNA of 40 microbes, and it provides colony-forming units per gram. That's the unit we use. It has markers for absorption, digestion, inflammation, and the immune function. It will give us commensal bacteria, which are those that are supposed to be there, but it can cause problems in either low or high levels. The phyla that we look at are the Bacteroides, Firmicutes, and then we look at a ratio of the Firmicutes to Bacteroides ratio. If the ratio is increased, we have a patient with a weight gain and obesity, and if the ratio is decreased, we see insulin resistance and increased inflammation. We get a special bacteria tested. In this test, you can get H. pylori, and you can get genetic markers for treatment protocol. C. difficile, you get opportunistic and dysbiotic infections, inflammatory and autoimmune inducing bacteria, viral antigens, yeast, parasites, and worms. In the upper left here, this is our H. pylori, and in this patient, it's positive. And these are virulence factors. These are those factors that are either positive or negative. And I'll show you what this means in a minute. It's not what you think. These are the commensal bacteria or keystone bacteria. These are your normal GI microflora. Here are the Bacteroides and Firmicutes. You can see in this patient, the Firmicutes is low, although the ratio is actually not too bad. Over here, we have opportunistic and overgrowth microbes. We have Siderobacter. These are inflammatory and autoimmune bacteria. And here you have commensal inflammatory and autoimmune bacteria. This is a real patient. I took the name out, obviously. But as you can see, this is a patient which has a large amount of dysbiosis. And this is going to take 6 months to a year to treat. We can't treat all of this all at once. These are the biomarkers that you're going to see here in this test. We have steatocrit, which will measure fecal fat, elastase, which will measure pancreatic enzymes, beta-glucuronidase, which will measure dysbiosis, liver dysfunction, and estrogen-induced diseases, occult blood, we're all familiar with. Secretory IgA is the primary immunoglobulin in the GI tract. If the levels are high, it's indicative of dysbiosis, infection, or food sensitivity. And if they're low, it's indicative of dysbiosis, stress, reaction and an immune compromise. Anti-gliadin IgA, so this is your response to gluten. Eosinophil activation protein, this is your infections and allergic diseases. This is your mast cell activation. And calprotectin is sort of your gold standard as an inflammatory marker. And you can differentiate between irritable bowel disease and irritable bowel syndrome. And zonulin is an intestinal permeability marker. This is a little bit more information on each one of these tests. I give you normals and abnormals. I just read through what each one of them does, so you can use this for your own use. And it's all, again, all the same tests, and it's kind of the again what the lab values are, high and low. So I wanted to show you this, the H. pylori, the antibiotic, it gives us resistant genes. Now, what this means is, remember, resistant genes. That means if it's marked positive, it means that this amoxicillin is resistant to H. pylori. So we need to use the negative antibiotics, the ones that are not resistant. So clarithromycin and amoxicillin, which are our usuals in H. pylori antibiotics, would not be effective in this patient. We also have parasites, and in this patient has N-amoeba coli. We also have some other tests that we use. We have the mucosal barrier assessment. This is a blood test. So the last test was a stool test, and it will measure zonulin, diamine oxidase enzyme, which degrades histamine. This will give you your mast cell, a look at your mast cell function. We also get histamine reaction also, and you can do a DAO to histamine ratio. And this one will also give you lipopolysaccharides. This is the meaning of each one of those. Low levels of zonulin doesn't mean anything. High levels is positive for intestinal permeability issues. Diamine oxidase, low levels are you have atrophied microvilli and permeability, and high levels deal with compensatory high histamine, and this is your mast cell activation syndrome. Lipopolysaccharide antibodies, low lipopolysaccharide antibodies indicate a overworked immune system that can have resulted from chronic infections, and they can treat immunoglobulins. You can treat with vitamins A and D. High lipopolysaccharide shows an active immune response, and we need to use antimicrobials or herbals, including berberine and garlic. This is a mucosal barrier test, and they're showing you a normal zonulin, an abnormal diamine oxidase, a sort of borderline histamine, and a borderline diamine oxidase histamine ratio. And this is the lipopolysaccharides, and these are showing in this patient are all abnormal. Here are some disease processes that are associated with high histamine, low DAOs, and high lipopolysaccharides. And again, I won't read through these. You can use this for your own information. Mucosal barrier tests are indicated in autoimmunity, food sensitivities, digestive symptoms, headaches, arrhythmias, cardiovascular disease, depression, anxiety, and any condition where you suspect a leaky gut. Treatment approaches for mucosal barrier issues. You want, again, remove the triggers, remove inflammatory foods, particularly gluten. So white flour, white sugar, dairy, corn are the bad guys here. Supplementation. So the diamine oxidase is the enzyme can be replaced. There are a number of supplement companies make diamine, good diamine oxidase. Vitamins A and D, omega-3 fatty acids. Quercetin is a potent anti-inflammatory. Antimicrobial therapies, particularly foods, garlic, oregano, and berberine to treat the dysbiosis, and immunoglobulins. You can use colostrum for an improvement there. There's a metabolic wellness test. This will give you a shortcut. Dr. Halasa is always talking about oxidative stress This will give you a shortcut if you don't want to don't have the money, don't have the time, or you want to do this sort of preemptive. This is a urine test, and there's markers for urinary indican is a marker for digestive issues, poor detoxification or urinary bile acid abnormalities, and for oxidative stress, it's 8-hydroxy deoxyguanosine. So this 8-OHDG is for oxidative stress. So this is a urine test that's pretty simple to do. This is an explanation of each of the ones here. So the urinary indican is a dysbiosis indicator. It indicates poor protein digestion. You can use it as a screening tool for dysbiosis, fermentation of the dietary tryptophan. And symptoms are associated with abnormal indican or maldigestion, protein malabsorption, hormone and fluid imbalances, gas, bloating, diarrhea, malabsorption, intestinal obstructions. Urinary indican, this is the test. You can get it as pretty much any medical supply house. Low or high, you can do this in the office. Low or high levels indicate a poor dietary protein, intestinal toxemias, putrefaction of undigested foods, and various stomach abnormalities, including insufficient hydrochloric acid, pancreatic insufficiencies, including trypsin and chymotrypsin abnormalities, hypochlorhydria, protease enzyme abnormalities, liver dysfunction, and you get increases in Salmonella, Staph aureus, and Candida. We get adverse reactions also in glycemic issues and hormonal balance. Bile acids, urinary bile acids these are bile acids not removed by the liver. This is a good screen for liver dysfunction, viral disease, liver cirrhosis, cholestasis. And the role of bile acids is to remove cholesterol. It's for fat absorption, glucose and lipid metabolism. Low total bile acids are present with inflammatory bowel disease, chronic malabsorption, starvation, and diarrhea. The urinary 8-hydroxy-2-deoxyguanosine test is for reactive stress. Result can reflect DNA damage, DNA breaks, base modifications, aging, and cancer developments, and is an increased source of oxidative stress. So Dr. Halas is not on this one. Somebody passed this along to him. This is a urine test that's easy to do. We see this in DNA abnormalities, mutations of genetic mutations, and clinical relevance elevated in lung, breast, and colorectal cancers, degenerative diseases, neurodegenerative diseases, including Alzheimer's and Parkinson's disease, and also metabolic disorders, respiratory disorders, neurological disorders, inflammatory conditions, and excessive exercise. To heal the gut, your dietary interventions, pre and pro and postbiotics, medication supplements, and also we've had a talk here on fecal microbiota transplant. You want to fuel the gut with wholesome foods, fiber-rich options, fermented foods, including yogurts, kefir, kimchi, and sauerkraut. Regular exercise, good sleep, stress management, the usual things. Limit your alcohol. Try to avoid toxins, including chemicals, pesticides, heavy metals, and environmental pollutants. Reduce, again, white flour, white sugar, dairy, gluten, corn. You want to be mindful of antibiotic use. Gluten shifts the microflora to a pro-inflammatory state, leading to a leaky gut. It renders the patient sensitive to gliadin and gluten sensitivity. Gluten digestive enzymes result in a opioid-like peptide formation called gliadin morphin 7 and casomorphin. The peptides are small enough to pass through the blood-brain barrier, and they compete for opioid receptors with normal neurotransmitters. These are behaviors associated with gluten sensitivity. And again, here your autistic behaviors, social withdrawal, slow behavior, slow speech, decreased coordination, loss of interest in activities, stealing, loss of concentration, apathy, mood swings, depression, and then physically, lack of weight gain, cramping, diarrhea, itchy skin, nausea, and lack of motivation, depressed mood, and hyperactivity. The 4 R's, again, remove the inflammatory foods, replace them with digestive enzymes, hydrochloric acid, and bile salts, restore the pre, and postbiotics, and also fermented foods, repair with L-glutamine, zinc, omega-3 fatty acids, slippery elm, vitamins A, B5, C, D, and E, and aloe vera. There are a lot of supplement companies make combinations, powders that have most of this in it. We also want to look at phosphatidylcholine and plantains for mucosal lining production, lactoferrin for gut-associated lymphoid tissue function, and acetylcysteine and green tea extracts are antioxidants and liver detox agents. Quercetin and nettle and curcumin are anti-inflammatory. Betaine restores stomach acid, and choline, glycine, and taurine will restore bile acids. This is a schematic of what I just went over as far as using the 4 Rs. The elimination diet is a good way to start as far as diets are concerned. All food reactions create some sort of inflammation. We get in abdominal pain, bloating, diarrhea, constipation, joint pain, chronic sinusitis, skin rashes, mood swings, poor concentration, and also things like high blood pressure, rapid pulse, insomnia, and fatigue. The elimination diet aims to reduce the trigger factors that aggravate symptoms. It identifies food triggers, reduces inflammation, supports a healthy microbiome, reduces toxic burden. And one of the keys here is that there's no caloric restriction. To plan it, again, the same triggers that we've talked about before. You want to set clear goals. I call them the RAT goals: reduce inflammation, alleviate symptoms, and identify triggers. The elimination phase must last at least 3 weeks. We're dealing with IgG sensitive food triggers. These are of 21 to 23 days duration. So it takes at least 3 weeks to get these foods, when you eliminate them, out of your system. They may induce a Herxheimer reaction. We will add some activated charcoal if the patient starts getting that. We reintroduce the foods, one ingredient at a time, and we observe symptom, and just a little bit at a time, for a symptom return. We aim for nutritional balance. We look at lifestyle factors, and again, the pre, pro, and post biotics. For the Herxheimer reactions, as I mentioned, activated charcoal. You can also use vitamin C, magnesium, and N-acetylcysteine or glutathione. Maintain a food diary. Remember, these are delayed food reactions. You're not going to remember what you ate. Today is Tuesday, last Friday. It takes 2 to 4 days to get these food reactions to develop. You want to document meals and symptoms. You want to adjust the diet as necessary, and you want to develop a long-term diet plan. These are go foods and no-go foods on your elimination diet. And I'll just go through the bad guys: trans fats, white flour, white sugar, foods that are high glycemic index, corn, soy, omega-6 oils, gluten foods, wheat, rye, and barley, saturated animal fats, dairy-containing foods, high temperature cooking with fats, and processed meats. Some maybes are eggs and egg whites. Those, you need to test those out individually: chocolate, coffee, and tea. This is a food elimination plan from the Institute for Functional Medicine from 2013. It's just kind of a list of good to go, not good to go, and sort of in between. There's also this list: eat what's on the left, don't eat what's on the right, don't eat what's on the left. Again, this is for reference. Special considerations: we'll just talk about eggs. You need some vitamin A. For carrots, you get them out of carrots, cod liver oil, spinach, sweet potatoes, mangoes. Biotin you can get from salmon, sunflower seeds, avocado seeds, mushrooms, and bananas. Histamine, we need to be careful with aged cheeses, alcohol, almonds, avocados, eggplant, fermented foods, legumes, nuts, packaged meats, seafood, spinach, and tomatoes. monitor the symptoms, and your step-by-step guide. Again, the IgG duration is at least 3 weeks and up to 6 weeks, and then eliminate the foods one at a time, and then we reintroduce them one at a time, and include additives and beverages there. Again, so as an example, start with 1 to 2 tablespoons of, say, corn, steamed.
Or Bill, you're muted.
I'm muted?
Oh, there, you cut off again.
Okay.
Am I the only guy that's not getting the screen or his desktop, of the images, the PowerPoint?
Are you getting them?
Yeah, we're
Yeah.
seeing it.
It's coming through clear.
Okay.
You guys are getting the PowerPoint?
Yes.
Okay, I'll be quiet.
Okay. There's a washout period for 2 or 3 days after a wheat introduction, per se, and then before testing gluten. Day 1 of gluten reintroduction, introduce a teaspoon of a vital wheat gluten, such as a small portion of gluten-rich food, and then observe over the next 48 to 72 hours. If the initial dose is tolerated, slowly increase it over the next several days. Wait a day or 2 before you reintroduce the next food. Sometimes you'll get some overlap. Wheat contains gluten, and then compare the patient's reactions between wheat and gluten reactions to better understand any differences. Then again, you want to go over with your patient the food diary, share any findings, and you want to adjust the diet as necessary. You want to I think I got some duplicates in here. Unique sensitivity. Patients have unique sensitivities. You want to give them a guided plan, and again, it's continued. This is a continuous system. Okay, your path to a balanced diet. Stabilize on the elimination diet. Reintroduce food systemically. Track the reactions and modify as things go. Microbiome remedies specifically. Probiotics. Again, prebiotics, spore-based probiotics we like a lot. It reduces facial sebum in acne and produces short-chain fatty acids, and the postbiotics. Specific probiotics, they don't work for all conditions. H. pylori, you need to take the probiotics 2 hours apart from your antibiotics to ensure efficacy. SIBO, probiotics are typically introduced after the bacterial overgrowth is reduced. H. pylori you want to use during and after the treatment for at least 4 to 8 weeks. Dietary support combined with prebiotics and postbiotics, and dietary hang on, I got this in the way. Low SIBO, you want to use a low FODMAP diet or a specific carbohydrate diet. And H. pylori, you want to use an anti-inflammatory diet. Everybody has individual reactions. Start low, go slow. Combinations sometimes work, and you need to do this again for at least 4 to 8 weeks for it to be effective. SIBO, Saccharomyces boulardii, spore-based probiotics, low fermentability probiotics, including Lactobacillus rhamnosus and plantarum, and non-bacterial enzymes can include betaine, bile acids, and can support the probiotics. For H. pylori, we want to use Lactobacillus reuteri, rhamnosus, bifidobacterium, or Saccharomyces boulardii. For inflammatory bowel diseases, we want to use the multi-strain probiotics, E. coli Nissl, which seems to be as effective as Mesaline 5-ASA in maintaining remission and ulcerative colitis, and Saccharomyces boulardii, 900 billion CFUs per day. Irritable bowel syndrome, Bifidobacterium infantis, Saccharomyces boulardii, Lactobacillus plantarum, and multi-strain probiotics. So these are specific for each one of these diseases. Quite frankly, we use the spore-based probiotics and Saccharomyces boulardii, and you're pretty much good to go. You see, it helps with all of them. C. difficile infections, diverticular disease, again, Lactobacillus casei and Lactobacillus plantarum, and microscopic colitis with Saccharomyces boulardii will reduce inflammation as effective in antibiotic-associated diarrhea. GI, upper GI remedies, again, GI barrier effects, hypoglycemic effects of berberine, which is anti-inflammatory and anti-neoplastic. Berberine will improve insulin sensitivity, insulin secretion, glucose and lipid metabolism, and it's an antioxidant. It will improve insulin resistance, and it will decrease total cholesterol, increase HDL, decrease LDL cholesterol. It's also anti-inflammatory. Vitamin A is anti-inflammatory and antimicrobial, and zinc will tighten the gut junctions and is anti-inflammatory. Grapefruit seed extract, we've been using this lately as our go-to for cholesterol when the cyclodextran proves to be prohibitive, usually due to cost or availability. Grapefruit seed extract will improve the functional GI symptoms. It will improve total cholesterol values, and it will decrease total cholesterol and LDL values. It will improve C-reactive protein levels, and it will also improve fasting blood sugar. It's antibacterial, viral, and antifungal. It inhibits candida. Dose is usually 250 to 750 milligrams twice daily. This is an herbal blend for SIBO of red thyme oil, or oregano, sage, and lemon balm. The herbal remedy has been shown to be as effective as triple antibiotic therapy for SIBO, and it's a rescue therapy when rifaximin fails. Simple carbohydrate diet reduces bacterial overgrowth and supports bowel movements. Candida overgrowth, we like Saccharomyces boulardii. Caprylic acid is a must. We use this 600 milligrams twice a day for 6 months. Silymarin is on the list. I don't use this one very much, and we do like garlic, 1,000 milligrams twice a day. H. pylori is a ubiquitous infection. It says up to half the world's population is infected with H. pylori. It produces urase. It neutralizes stomach acid, allows colonization of the gastric mucosa, damages stomach lining via inflammation, toxins, and disrupts gastric homeostasis. Its effects go beyond the stomach. There's extra gastric conditions, including rashes, joint pain, autoimmune issues, skin issues, atopic dermatitis, and complex interactions due to immune dysregulation and chronic inflammation. Etiologies include crowded living conditions, lack of hygiene, and poor dietary factors, including excessive alcohol consumption. Diagnosis, the non-invasive tests, including urea breath tests, stool antigen, serology tests are done. You can do also invasive procedures. You can have an endoscopy with a biopsy, comprehensive stool testing with microbial balance. It can be done for inflammation and digestive enzymes. Gastric pH testing can lead to a clue. H. pylori leads to hypochlorhydria. Food sensitivity testing can identify triggers. Treatment, the standard treatment is triple antibiotics, triple therapy, 2 antibiotics and a PPI, clarithromycin and amoxicillin. But I showed you in the GI map test that was resistant to that. Metronidazole and pyrazole are also useful, and you can do a fourth. You can add some bismuth for quadruple therapy. You can do this sequentially or concomitantly. Acid suppression, PPIs are used to reduce stomach acid to improve antibiotic effectiveness. H2 blockers are sometimes used for acid suppression. And again, keep an eye on the, got to retest every 4 to 6 weeks until it's eradicated. Botanical antimicrobials can include mastic gum, berberine, oregano, and manuka honey, also grapefruit seed extract. So, and a lot of these supplement companies will make a combination of these. Restoration of gastric function with betaine to restore stomach acid. Zinc carnosine is an anti-inflammatory. That's one of that, and deglycerated licorice. That's our go-tos for upper GI symptoms, including GERD. Vitamin A, 25,000 units. Vitamin D, 5,000 units. And the probiotics and gut microbiome balance, as we discussed a lot already here today. Anti-inflammatory diet emphasizes whole foods as an antioxidants, avoids irritants, zero sugar, zero wheat, zero dairy. We want to do stress reduction techniques, meditation and yoga, improve sleep and exercise. This was a study done with 39 patients taken at random with the GI symptoms, and they were given mastic gum, oil of oregano, and Pepto-Bismol, and they had 74% of them had the H. pylori eradicated. Prevention, you wash your hands, good dietary choices, probiotics, fiber-rich foods, stress management, a couple of if the patient has some cognitive issues, sulforaphane will reduce interleukins 2, 4, 6, and interferon gamma. This is found in cruciferous vegetables. Curcumin reduces oxidative stress. Green tea extract and lithium orotate modulates neurotrophic response. Again, I showed you this before, the reason we get the cognitive disruptions here. This is sulforaphane increases 3-alpha hydroxysteroid dehydrogenase. It increases dihydrotestosterone to 3-alpha androstenedione, which will increase your androgens, increases cognition, reduces neuroinflammation, and can also affect hair growth. The gut-brain axis support, again, high-fiber diet, psychobiotics, anti-inflammatory diet, autonomic nervous system rebalancing. Again, L-glutamine, vitamin D, lactobacillus, and fiber. Probiotics, vitamin C and E and zinc. Boswellia, omega-3 fatty acids, neem, and collagen. Fecal transplant, we had a whole lecture on that. It's on our website. Can restore healthy microbial ecosystem. The stool's transferred from a healthy donor to the gut of an unhealthy donor. It has to be FDA approved, and it's FDA approved only for C. difficile at this time, although it's been used for all of these other GI and even anxiety, depression, and autistic symptoms. Healing the microbiome and leaky gut restores microbial diversity, strengthens the gut barrier, and it modulates the immune system. Healing the gut axis, again, neurotransmitters, immune and cytokine modulation, and behavioral and cognitive changes. The skin controls inflammation and hormones and barrier support. Challenges with fecal microbiome transport. There's been a capsule that's been developed. I think it's still in an experimental state. We can get a personalized microbiome this way. The FDA has sort of stuck its nose in the way and regulated only for C. difficile. There are strict donor screening protocols, and there's a lack of standardization. The mechanism of action eliminates dysbiosis, reduces inflammation, enhances the gut-brain barrier, and it's useful for leaky gut, mental health disorders, and skin disorders. This is just a summary of the intestinal biomarkers that we discussed here. This is sort of your takeaways to put next to your desk if you want to use them. If you want to use that, here's the factors that influence the microbiome that we've discussed. Genetics, living environment, dietary habits, physical exercise, concomitant diseases, supplementation, pre, pro, and postbiotics. This is your cortisol excess. This is your healing for that. And this is your 4 R's. And I want to thank you all. And we have, we always want to say, my doctor said there's no evidence of, and fill in the blank. And so for the microbiome, we have 173 references. And okay, it's over. Go home. Questions? Is anybody still there?
We're here. We're just so baffled and amazed.
There's so
That's
much.
what it is.
Too much?
Yeah. Mind-blowing and intense.
Agree. Highly agreed.
That's what Dr. Klatz always says.
So now I have a new topic to discuss when I see patients in a nursing home. Look at their skin and not about their constipation problems, right?
I've told you that before.
Right.
It's not
I've told you that anytime you've heard any of my female hormone lectures or testosterone for lectures. I've told you guys all that before. So
Yeah, that's how it's like your litmus paper test.
yeah, I see there's some messages and whatnot. You want to read them, or you want me to read them, or
Yeah.
how do you want to?
So most of them are John's ad, but I have some questions on my
John Burgess
email.
Yeah. Okay.
He was plugging for the
Yeah.
he put pictures up there.
Well, I'm trying to give warning. We only have 30 days prior to the event. I have to have all people, names, that type of thing.
Well, that's why you didn't give us a whole lot of notice here.
No, we get a year to pull this off. I have 1 month.
Yeah.
Why is it so important to hit that date, Doc?
Before I die, dude, I just want to get the shit done.
Are you telling me after June 1st you're dying? Is that what you're telling us?
What the?
No, I just had a reminder of how short life is. I want to go ahead and get this done, and also it's opportunistic.
John, I didn't give you permission to die, so don't even think about it.
Yeah, you're not allowed. John. You're not going anywhere.
He's not on the schedule.
Permission. He cannot do it. We'll resurrect you.
You're not going anywhere.
We'll have to come over there and kick your ass back into life.
Right.
Well, Bill already has.
There's one here, and I think I got it backwards. Dr. Adebajo, it said, does acromantia increase with age? No, it decreases with age. To reduce obesity, we need to increase acromantia. I got that backwards. So, but
low and high acromantia isn't good.
No,
both are bad. One thing on zonulin, if you're measuring the actual agent, is got a super short half-life, and it bounces all over the place all day long. Yeah. So you want to make sure you're doing zonulin antibody, which lasts about 7 days.
Yeah, we usually get
it's much more.
We usually get it in the stool. We don't usually do a serum or urine.
Oh, interesting.
Yeah, it's a little bit more stable.
All right. So I put all the stuff, a bunch of stuff in the chat, but this is your show, your program. You could do it any way you want to. Dr. Quinn is the major voice in a lot of this stuff. I'm just trying to get it done. And so this is a start. It's a framework, and we can do it.
So it came out sort of jumbled here in the chat, John. So.
Yeah, it's jumbled all as hell. Yes, it is.
If you
get photographed,
get me a clean copy. I'll send it out as an email. Okay.
All right.
Please. Yeah.
Okay. All right. We'll do that.
Okay.
Dr. Bill, somebody's asking about labs that you
hang
using.
on.
I mean,